I have been up doing this all night.
I know, it's okay. I think he's really going to like it.
You think
yeah,
so?
I read
Okay.
it and it's great.
Oh,
Don't
hi,
worry.
boss.
Hello, girls.
Hi.
Do you have the report?
Yeah, it's right here.
Well, this sucks. Never send a woman to do a man's job.
Oh my God, he's having a heart attack.
He can probably write it out. Let's just give it a few minutes.
Don't let this happen to you. When coronary artery disease strikes you or a loved one, you may wind up in the hospital, or worse.
Hey, girl, how's your
Hey.
drive?
Oh, I'm good.
Yeah.
How was your night?
It was a rough night, huh?
Are you
I tell
busy?
you. It was slammed. We
Oh
had
my gosh.
We had a guy come in. He was having a heart attack. He had in the office, and I guess he pissed off one of his employees, and they delayed calling. So
wow.
he died in transport to the hospital, and
Oh, no.
I just spent half the morning trying to revive him, but
Oh.
he was gone.
Oh,
Couldn't do
I'm
anything
sorry to
about
hear
it.
that.
It's okay. It's life in the ED.
Okay.
Yeah, okay, well, do you want to give report on your patients?
Yeah, well, let me tell you what's going
Okay.
on here. So I have Mr. Phil. He's a 62-year-old male. He was in a car accident this morning. He came into us at 1:15 by ambulance. He has a broken left tarsal and a left orbital fracture, and 3 rib fractures on his left side. We took him into surgery at 2:10, and he came back to the floor at 4:15. His vital signs are stable. As of now, he's a little bit anxious, so I gave him a little bit of morphine for his anxiety, and he had a pain of 8 out of 10, so the morphine was also for his pain, okay?
Okay.
And I gave that to him at 4:30 this morning.
And how's his pain now?
So I reassessed his pain 30 minutes later, and he said it was manageable, a 3 out of 10.
Oh, good. Okay.
So he has bruising, so he has that pain on his left side,
Okay.
okay? He has the surgical incision.
Mhm.
He has bruising, a lot of bruising. Let's see, he has bandages there, they're clean, dry, and intact. He's currently on room air, but we might want to put some oxygen on him.
Okay,
a
why?
little
What's
bit.
his saturation?
His saturations were trending at 98 out of surgery, but he's been, like, might want to reassess that.
Okay.
He has an 18 gauge needle in his right AC, and it's currently infusing normal saline at 50 milliliters per hour. He also has a Foley. His urine output looks really good. He's at 45 milliliters an hour.
Okay.
And let's see here. Anything else? Oh, and his urine is clear,
Okay.
and it looks really good. There's no blood in it or anything.
Okay, is he on clear liquids or is he eating regular meals at this point?
He's on clear liquid diet right now.
Okay.
He does have a gag reflex, but he can have meals a little later.
Okay.
Let's see. I just recommend his blood pressure is a little high.
Mhm.
He's trending normally at 160 over 80. And that's his baseline. He says that's pretty normal for him.
Is he on any antihypertensives?
Yeah, I recommend giving him a losartan, his ACE inhibitor, and just reassessing his pain.
Okay.
Any other questions?
Nope, I will go in there and introduce myself and check him out.
All right.
Thank you.
You're welcome. I'm gonna get out of here.
Good afternoon,
Hello?
Mr. Phil.
Hello?
Hi, I'm Jenny.
Oh.
I'm your
Hello.
day nurse coming on shift. How
Hello,
are you?
Jenny. I feel terrible.
Oh no, I'm sorry to hear that.
Yeah.
I'm going to be in here for the next while. I want to assess you and take your vital signs.
Well, alright.
Okay, and check your pain level and everything. Is that okay?
I guess.
Oh, okay. Well, let me just start here. Let me get you situated.
You know, I actually, I'm not sure it's
Just
fair.
be quiet!
Nurse!
Hi, Mr. Phil, how are you? What's going on?
I'm feeling short of breath.
Oh my gosh, okay, let me go ahead and assess you here. I want to listen to your lungs and your heart.
Okay.
Oh, good deep breaths. Okay, can you sit up?
I'm feeling anxious and diaphoretic.
Can you take a deep breath for me? Okay. Okay, if you want to lean back down. Okay, I'm going to be right back in. I want to give the doctor a call, okay?
Radial and pedal pulse is weak. BP is 110/80. Resps 24. Heart rate 105. Lungs are clear on auscultation. Patient appears anxious and diaphoretic.
I feel terrible.
What's going on? What are you feeling?
I'm dying over here.
Oh, okay. Well, let me go ahead and do an assessment on you real quick.
Okay.
Okay, I want to listen to your heart.
Right.
Can you take some deep breaths for me? Blow out, please. Just try to relax. Okay, can you lean forward? All right. One more time. And out. Okay, go ahead and lean back. Okay, and get your BP going here real quick while I check your pulse.
Okay. Oh God. Oh God, I'm dying. I'm dying.
We're going to take great care of you. Just relax.
There's something wrong with me.
It's okay. I'll
I'm dying.
see what's going on here.
I'm extremely anxious.
Just try to relax. Take some deep breaths. I'll be right back.
BP is 95/70. Respiration's 33. Heart rate 120. Other vital signs are normal. JVD and muffled heart sounds, but lungs remain clear. Radial and pedal pulses are almost diminished.
The doctor said you have, according to the echocardiography, you have a cardiac tamponade. I need to take you to the OR for immediate surgery.
Fine. Oh, hello. I didn't hear you come in. But I'm glad you're here, because I'd like to talk to you about cardiac tamponade. Here's a diagram of the heart. As you know, the heart and the great vessels are all surrounded by a tough fibrous layer called the pericardium. It actually consists of two layers with a potential space in the middle. That is, the two layers are compressed like this, but they're not really attached. There's a small amount of liquid circulating in that space, so that the heart can move a little bit and is lubricated. But it's not, the external layer is very tough, so that if liquid happens to seep into that potential space and begin to expand it, the outer layer cannot really expand. The pressure then is all inward, compressing the heart and preventing it from beating. If this happens quickly, as in the case of trauma or after open heart surgery, as little as 100 milliliters of buildup will cause the heart to be unable to compress, in which case you'll have pulseless electrical activity. If it happens slowly, the pericardium can expand, holding as much as 1,000 milliliters of fluid before you see that kind of compression. But in the case of trauma, it can happen very quickly, and it compresses the heart until it can no longer beat.
That's all, folks.